What up YouTube? My name is Noble Nguyen and I am a 30 medical student. Welcome to my channel. So currently I'm on my internal medicine rotation for the past 2 months, mainly doing inpatient medicine, which means that I've been seeing and treating patients in the hospital. So in this video, I'll be showing you guys what it's like to do hospital medicine. So let's get to it. So usually I come into the hospital at 6 o'clock in the morning. The first thing I do is chart my patients. This includes looking at morning labs, recent lab results, and provider's notes from yesterday and overnight. This usually takes about 30 minutes to an hour, depending on how many patients I am seeing. After I'm done charting, I then go see my patients. I ask them how they're doing, do a physical exam, and update them on the plan of treatment. So after I see my patients, I go to the main room where we do something called rounding. And that's when I present my patients to my residents and my team physician, and we go over my assessment plan. So usually, we do something called bedside rounding, where we as a team will go to the patient's bed and do this. Due to COVID, we want to be cautious and not spread the disease. So this is how rounding usually goes. Alright, so we have a 26-year-old male with a past medical history of hypertension, diabetes, blah blah blah. On physical exam, vitals are all within normal limits. He was acute alert, non-acute stress male. More blah blah blah. Labs show a CBC of 13.5, which decreased for say from 15.0. And the last part is the assessment and plan. And that is how you present an oral presentation. So that is my patient. Any questions? After morning rounds, which ends around 11, I then start writing my progress notes for my patients. The rest of the afternoon includes following and ordering labs, updating family members, talking to consults, and helping out the team in any way I can. That is pretty much my normal routine when I'm on day shift during my internal medicine rotation. Alright, welcome back everyone, and welcome to night shift. So for me, nighttime shift usually is from 6 p.m. to 1 a.m. which isn't too bad given the resident I work with stays from 6 p.m. to 6 a.m. So I would like to take that. So what is the difference between nighttime and daytime shift? There's not really much of a difference. I still chart my patients, I still see my patients, and I still write some notes for my patients. The only difference is that there's no official rounds where I present in front of everyone. Instead, I usually just present my patient to my resident, and it's pretty informal and chill. So for me, nighttime shift is the time where I learn the most. So after we see all the patients, it's usually pretty chill, all the patients sleeping, and it's time for me and my resident to really talk about the different pathologies. So it's time for me to really learn and pick the brains of the residents. And so far, all the residents I've worked with have been pretty smart and really helpful. Alright, so the last thing I want to talk about are admits. So what are admits? Admits are patients who need to stay overnight in the hospital. So as hospitalists, it's our job to admit patients and to take care of them afterwards. So most of the admits for us comes from the emergency room. So this is how it usually goes. Hey, this is Dr. Tran calling from the ED. I have a patient in room 4 who came in with epigastric pain ranging to the back. We ordered a lipase panel and it came back to be elevated at 550. CT of the abdomen and pelvis is still pending. I think he has pancreatitis. Do you mind coming down to examine the patient for possible admit? Hi, this is student Dr. from medicine. Yeah, looking at his labs and imaging, I agree. It probably is pancreatitis, but let me go down in the ED to examine the patient and let my attending know about my findings. And I'll let you know whether we will admit the patient. Is that okay with you? Alright, so after we decide to admit the patient, me and my resident will then go to the ED to take a thorough history and physical of the patient. Afterwards, we present the patient to our attending physician, and from there, the patient is admitted. We'll place some orders, and then the patient has the bed for the rest of the night. Alright, so this is the sleeping room. This is the place where the residents go if they are tired and they want some shut-eye. Of course, I don't really use this room because, sleep is for the weak. So that is my internal medicine rotation. So you stick to the end, you guys are the real MVPs. Thank you so much for watching this video. I hope you learned something new. Until next time, peace.
Sometimes all I think about is you. Late nights in the middle of June. He always been faking